Hello viewer, hujambo. Welcome back again to this YouTube channel where I, Grace the Nurse, talks about mother and child health care. May I take this opportunity to thank you for your valued companionship in this continuous series of mother and child health talks. Our last lesson, we talked about growth monitoring for a child using weight in kilograms. From our book, reference book, we saw the graph which helps us to come out with an outcome of a child who has a normal weight, an underweight, or an overweight. Today, we are going to assess the child nutritional status using a measuring tape called MWAC. So, how do we use the measuring tape to assess a child malnutrition? What we should understand is that the MWAC is used to screen children who are sick, who are weak, and children who are thin. Yes, we assess the nutritional status of children who are brought to the hospital for malnutrition when they look thin, they are weak, and they are sick. The reason why we do that is because these children are at risk of dying. Hence, they need referral, or the caregiver needs counseling on feeding. Number 2, we should know the age bracket for children who are assessed nutritional status. The age bracket. The age bracket for assessing a child for malnutrition is from the age of 6 months up to 5 years. So all children who are brought to the hospital, they look sick, they are thin, or weak, they are assessed their nutritional status as far as their age group of 6 months up to 5 years. Now, there are 2 classifications for malnutrition. Malnutrition has got 2 classifications. The first classification is called severe acute malnutrition, or SAM. And the second classification is called moderate acute malnutrition. See, in both of them, there is the word acute, meaning that this thing happens within few days, within the last few days. The opposite of acute is chronic. So here we are not assessing for a chronic malnutrition, we are assessing for an acute malnutrition. Why? Because this child could have been sick, the child has become weak, and the child has also become weak. And this child is at risk of dying and needs referral for a further assessment and a treatment. Now, what part of the body does the MWAC tape use to assess the child malnutrition? The part of the body that is used with MWAC tape to assess the nutrition status of a child is the mid-upper arm circumference. So the part of the body that is used is the arm. And mostly it is the left arm. The left arm is used to assess the child nutritional status using the tape called MWAC. And MWAC is short for mid-upper arm circumference. This is the tape. It has 3 color indicators. You can see the numbering in centimeters. So it has 3 color indicators, the red, the yellow, and the green. So anytime your child is assessed and the measurement falls in lead, that child is having severe acute malnutrition. If the child's measurement is falling in yellow, that child is having the moderate acute malnutrition. And if the child is falling in the green color code, that child has got no malnutrition. So this is the MWAC tape. It uses the mid-upper arm circumference of a child aged 6 to 5 years to assess for their nutritional status. So how to do it? If this is the arm of the baby, if I can assume this is the arm of the baby, we just take this tape and wrap it around. You see how that one is wrapped? Yes, that is how we wrap the hand. Then there is a window here where the tape goes in. Yes, the tape goes in through this window like this, and the arm of the baby is inside here. So if we wrap the arm with the tape and the measurement falls somewhere there in the green, that is, you can see there is an arrow there showing up and down arrow. If I can bring it nearer, that one will tell you that the child has a normal nutritional status. If it goes to there, meaning the arm of the baby is inside here and the tape goes to the yellow, as the indicator is showing, yellow there, it means the child is having moderate malnutrition. But if the tape goes completely to red and that arrow is showing the red area, that child is having severe acute malnutrition, meaning the arm is inside here but it is too thin to be wrapped with the tape. Yes, so that is how we assess a child for severe acute malnutrition or moderate acute malnutrition. Both of these children will need to be referred for further management and nutritional therapeutic feeding.